Good morning, all. I'm Bernie Rosof, Chair of the Roundtable on Health Literacy of the National Academy of Science, Engineering, and Medicine. And I do know we're going to have a splendid day today because the topic is really germane to a lot of the work that everybody around this table is doing. The paper was one of the better papers I've read on this topic, so we're pleased to have a discussion about that paper. So it should be a wonderful day for all of us between now and 5 o'clock. I'd like to welcome everybody to this workshop. I also want to let everybody know that this meeting is being videotaped and recorded for webcast across the internet. So with that in mind, we will confine our comments to the appropriate questions that will be asked during the day. The mission of the Roundtable on Health Literacy is to inspire and activate a wide variety of stakeholders to develop, to implement, and share evidence-based health literacy practices and policies with the goal of improving the health and well-being of all people in our nation, and really all people internationally. As one of its major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and concern, such as the focus of today's workshop: quality performance measures for the integration of health literacy, cultural competence, and language access services. I can't think of anything more important than integrating health literacy, integrating cultural competence, and language access services, and we'll see how important that is as the day progresses. Aging and the evolving racial and ethnic composition of the United States population has really placed the nation in the midst of a profound demographic shift. Public health and healthcare organizations face many issues as they move to address and adapt to this change. And the change is occurring on a regular, continuing basis. In order to adequately serve these changing demographics, health organizations need approaches that will enable them to provide all persons with the ability to obtain, with the ability to process, and understand basic health information and services needed to make appropriate healthcare decisions. Important not only for the patient, but for the family and for the public, obviously. One of the 6 aims, as defined by the Institute of Medicine for improving healthcare, is to provide care that is equitable, that is care that does not vary in quality because of personal characteristics such as gender, such as ethnicity, geographic location, and socioeconomic status. Increasing health equity and reducing health disparities requires aligning health system demands and complexities with individual skills and abilities. By individual, we mean patient, public, and the provider team. Because health literacy, cultural competence, and language access services are inextricably linked, such alignment requires an integrated approach to providing services and measuring performance. How do you measure success? What are the metrics of success? And really, what does success look like at the end of the day? Therefore, measures of quality performance are needed that assess this linkage and integration. Measurement for performance improvement, as all of us know, also implies accountability. Accountability to the patient, accountability to the public, and of course, accountability healthcare team. The Roundtable has undertaken a project that is designed to foster an integrated approach to health literacy, language access, and cultural competency. The 3 components of the project are, first, a paper to establish a framework to integrate measurement of health literacy, language access, and cultural competence, with the primary goal of using this approach to improve quality of care and reduce disparities. And I must say, as I've already said, and I'll say it again, I really enjoyed reading the paper. I think it really has done a wonderful job of putting together exactly what that Roundtable was interested in having occur. The National Committee for Quality Assurance, NCQA, was commissioned to prepare that paper, which is available today. We all saw that as a handout, and also available on the Roundtable website. The second component of our work is this workshop. During the workshop, you'll hear from the authors of the paper, as well as from reactions from individuals representing a number of different stakeholders who did receive the paper in advance and thus have had the opportunity to review it prior to this workshop. The third component of the project is a second commission paper that will focus on how an integrated approach could be implemented. So we'll go to implementation after we go through the first two stages. This paper will be commissioned following today's discussion and will incorporate information obtained in the workshop. So the information and the discussion around the table today is quite important to the entire project. The agenda today encourages active participation, really to enable an informative discussion. I want to thank the members of the Planning Committee who organized this workshop. Let me just mention who they are: Ignatius Bow, Helen Burston, who could not be with us today from NQF, James Kroll, Darwin DeWalt, Christopher Desi, Michael Pash-Orlo, and myself. I also want to ask Roundtable members, as I always do, and this goes back to a long tradition, to be thinking creatively about key points you think are important to highlight, because at the end of the day, I will be asking each of you to provide us with one or two sentences about important points made. Once again, that's helpful to us as we review the workshop. Before we begin, once again, I'd like to remind everybody to please stay within the time allotted so everybody will have an opportunity to share their knowledge, and in addition, so that we can have a rather robust Q&A subsequent to each discussion. It enables more information to be imparted around the room. Also, Melissa French, raise your hand down the end. She will hold up cards with a 5-minute, 2-minute, and 0-minute left on your time so that you'll know when your session is drawing to a close. And this will once again enable us to keep reasonably on time as we go through a rather important day. So, we will begin the workshop with a presentation from Jessica Briefer French. Ms. French is a senior research scientist at NCQA who has worked in healthcare quality for 20 years. Over the last decade, her work has focused on measurement and evaluation of quality of care. You can read more about Ms. French in the handout, as you can about all the speakers, by the way, where bio-sketches are available. Ms. French will present the commission paper, a proposed framework for integration of healthcare quality measures related to health literacy, language access, and cultural competence. It's really an integrated measurement approach to improve quality care and reduce disparities through a patient-centered framework. And I must emphasize that, once again, this is a patient-centered framework. Following her presentation, we will have time for questions and answers, and we will have that occur immediately following the presentation. Ms. French, the stage is yours.